Committee of Medical Directors for Naija, led by Professor Emmanuel Obaseki, Chief Medical Director of Uyo University Teaching Hospital, don commend Edo State Governor Godwin Obaseki for his sustained investment for health and other sectors of the state economy. They come acknowledge the governor as one of the best performing governors for the country. The Chief Medical Directors gave these recommendations to the governor on Wednesday, 10th May 2023 for their courtesy visit to Government House for Benin City. Professor Obaseki commend Governor Obaseki for the ogbonge work wey they do across all sectors of the state and in sustained investment and commitment to reposition the healthcare sector, especially for strengthening the primary healthcare system for the state.
We are here on our normal quarterly meeting, but this is a special and unique meeting in that we are also here to join our brother CMD to celebrate 50 years of UBTH, one of the leading teaching hospitals in Nigeria. I would believe a center of excellence in healthcare in the country. So, sir, we also want to thank you for your strides in the healthcare delivery system. Even before the healthcare, we have been informed that you are the only governor who is paying a minimum wage of 40,000 naira to your staff. So thank you very much. You're also the first governor who was paid 100% CONMES to doctors in the state. Again, we want to say thank you. We want to thank you for the strengthening of the primary healthcare sector, which is very important, because without that foundation, we really cannot get tertiary healthcare. Most of the challenges we face could have been solved at the primary healthcare level. And we hear you have been revamping, you have an ongoing revamping. Most of the PHCs in the state are being revamped, and we want to say thank you so much. As part of this meeting, sir, we are here to join our brother, to mark his 50th anniversary, but it's also an opportunity for us to benchmark ourselves. So we go around the different hospitals and different centers, and we see and we learn from best practices. Today, before we came here, sir, we were at the University of Benin Teaching Hospital, and I want to say that each and every one of us is very impressed with the giant strides that has occurred in the hospital in the last 6 years. We are impressed with our colleague, Professor Obaseki, and we believe that even before he finishes his term of office, he will do a lot more. So, sir, we really want to thank you. There's really not much to say, but the truth is that you are one of the best performing governors in this country. And politics aside, we wish you the best in your future endeavors.
The medical director can tell the governor say dem not be political committee, but na policy and advocacy group dem be, and say dem dey meet with am to discuss and torchlight effective and sustainable policies, especially for our tertiary healthcare for the country. He can thank the governor wella for the support where Edo State healthcare system they receive from Edo government. Professor Obaseki can say Obaseki stand gidigba for healthcare financing and say dem thank am for the Edo State Health Insurance Scheme and for the support when they give University of Benin Teaching Hospital UBTH, especially for the COVID-19 time, as say na 60% of COVID-19 testing them do for UBTH.
This committee, we're not really a political committee. I think we are more would call ourselves a policy/advocacy group, in that we meet to deliberate. We try to advocate for effective and sustainable, policies, especially for the tertiary healthcare delivery system of the country, and also issues concerning our welfare. So talking about welfare, sir, on behalf of my colleagues, I want to thank you sincerely from the bottom of our hearts for the support you have given to the hosting of this meeting. We've been told that the very nice accommodation that we're all staying has been courtesy of you, so I want to say thank you very much, sir. And also another pillar which we have heard that you are very strong is the healthcare financing. We want to thank you for the Edo State Health Insurance Committee, Corporation Commission, which you've established with emphasis on sustainability. So thank you, because one of the challenges which we are discussing is the fact that most of the patients we see cannot pay their bills. And without a sustainable healthcare financing mechanism, the honest truth is that the healthcare sector would not develop. In most of the industrialized countries, most of the innovations you see are because people pay and can afford, and there's enough money, for people to invest in healthcare. So I think it's a major step in the right direction, and for that we say thank you, sir. And much more, sir, we want to thank you for your support for UBTH, especially during COVID-19. The support for the isolation center, the molecular laboratory, and for the treatment. We learned that over 60% of the COVID tests in this state were done in UBTH. And that would not have been possible without your support. And also the ongoing collaboration between your state, the state government, state health sector, and the federal health sector. That's the way to go. Because unfortunately, what we see in this country is that health is treated in silos. You talk about primary health care, secondary, as if there's a whole lot of interconnectivity. If one sector doesn't work, the other one will not work. So thank you for the collaboration, and we ask, please, for more support for UBTH.
For him to talk with the Committee of Medical Directors, Governor Obaseki reaffirmed them of Edo government commitment to continue to strengthen the state healthcare system, and say he blamed the wahala wey the former Deputy Senate President, Senator Ekweremadu, dey face on the nation's bad health system. Governor Obaseki talk say Ekweremadu matter no sweet am for belle at all, and say e dey somehow say Naija politicians dey fail to provide ogbonge healthcare system for their people. He say if we not strengthen our healthcare system, we dey put ourselves for risk. Say we need to collaborate to build ogbonge healthcare system wey go benefit our people wella.
For us in Edo, we have a commitment which is total to this strengthening of the Nigerian system, including and particularly the healthcare system of Nigeria. As you're all aware, because we're all part of it, COVID was an eye-opener. It was a wake-up call for all of us Nigerians to understand that if we don't strengthen our healthcare system, we are all at risk, even those of us who are privileged. In fact, we are more at risk. So it's in the interest of us in politics, you providers, to ensure that there is a seamless and very intimate collaboration to ensure that we build a resilient healthcare system for the benefit of our people. One of my very saddest days was a couple of days ago, when I read about the conviction of Ekweremadu in the UK. It was very, very sad. That here you have a situation, two Nigerians, a patient, a donor, and I'm almost certain that the person who is going to do the transplant in the UK may also be a Nigerian, leave their country to another person's country to perform what will otherwise be a life-saving operation. And look at where it's ended. Just because we have failed to provide for ourselves the quality of care for ourselves. So for us in Edo, I think it's so important that we understand that there is one healthcare system, because the day you fall ill, God forbid, you are not going to be able to determine where they will take you to, whether it's a state hospital, it's a private clinic, or a federal hospital. You just want cure. So it's important that we see our healthcare system as one, and that those of you who have the privilege of working in the federal ones established by the federal government that are supposedly, they're supposed to be centers of excellence, must now understand the responsibility to help us pull the entire system up to the level it should be.
Obaseki come say we get correct doctor wey sabi and nothing suppose stop us, and say for over 50 years UBTH don produce ogbonge doctors wey sabi the work. Say during COVID-19 wey we need doctors, we get about 5,000 of them. E come say for the last decades our doctors dey run go obodo oyibo. Say we no go succeed for our medical profession if we leave the system make e bad finish. Dat na why im administration dey on top healthcare matter to provide ogbonge healthcare system for our people.
I hope that your stay, because you say you're an advocacy group, and that as you reflect, help us reflect on the healthcare system, on UBTH. For us, UBTH means that we have been producing doctors in this state for 50 years. And during COVID, when we scanned the state for medical doctors and senior care providers, we found more than 5,000 of them, which I thought was quite profound. So if we have a core building block for a healthcare system, which is the doctor and the associated medical professional, then what is holding us back? What's holding us back? Why must we go outside of this country to get care? So as you sit and deliberate, think through policy, I think you must see 50 years of UBT as a challenge to our healthcare system. If we've been producing doctors in this place, I'm sure UCH is much longer, for the last 6 to 7 decades, and exporting these people abroad, then what has gone wrong? And how do we quickly begin to fix what's going on? Because with COVID, when COVID came, none of us could escape. We were all here, stuck. So the issue of, I'm going to see my doctor in Dubai or in UK or in India, we just look at their rights. So I think, as you deliberate, as you think through the issues of healthcare in your quarterly meeting in Benin and subsequent ones, I think it's important that we must continue to emphasize and reflect on the fact that as professionals, we will not have succeeded to the extent of our aspirations if we leave Nigeria and its healthcare system the way it is today. I am sure all of you agree that when you went to training, this system we had was better and stronger than what we have today. So we cannot say we've succeeded if we leave or retire and leave a system that's weaker than what we met. It's a challenge, but if you in this room can't solve it, then nobody will be able to solve it.
From Government House, Benin City, A. Carter Ojesele, TMC TV News.